Welcome back to Studio One. Did you know that 1 out of every 9 expectant mothers delivers prematurely? However, few expectant parents consider the possibility that their baby might need special medical care after birth. And even fewer anticipate what medical attention their baby might require in such a situation.
The Canadian Specialist Hospital, based here in Dubai, has just celebrated the first anniversary of its neonatal intensive care unit, which provides resources for newborns who need specialized medical care.
Here to tell us more about the unit and some of the challenges faced by newborn babies is Dr. Shoaib Shahzad Khan. Thank you very much indeed for being with us, Doc. And let's start with premature babies, if we can, because obviously, congratulations on celebrating the year of the new unit. But for those parents out there that, as you said, you know, the statistics are pretty amazing. What are the dangers of having a child prematurely? Can it come back to affect them in later life?
See, the first and foremost, when a baby is born very premature, obviously the baby even cannot breathe on its own. So we need to put special tubes into their lungs and put them on artificial ventilators to help them breathe. Then we give some special medication to the lungs to make them more mature. Secondly, they have very fragile blood vessels in the brains. So if anything goes up or down, any sort of stress, they can bleed in the brains. You know, all those things, they are very, very fragile and tender babies. Their kidneys, their liver, all the gut, intestinal tract, everything is immature. So we need to give them environment which is as close to maternal womb as possible, which is obviously 100%. It's not possible to give them that environment, but we tend to give them as close an environment to the mother's womb as possible.
So the technology we're talking about, it's not just the latest state-of-the-art technology in keeping an eye on the child and monitoring its progress. It's also recreating that environment, is it?
Of course. That is very, very important.
Okay.
Very important.
So what kind of reaction do you get from parents when that newborn baby is admitted into the NICU?
See, most of the parents, they are not anticipating premature births, because they feel that they will go to the term and they will deliver a normal baby, and they are planning accordingly. Then suddenly, whether it is due to maternal factors or fetal factors, if this turns up that they get a premature baby, they are really frightened, they are scared, they don't know what to do. I mean, the moment they say this is such a small baby, which they have not obviously planned. So, and they have a million questions, because first and foremost, they don't even know whether the baby would survive or not. Okay? And then we have to be obviously very, very compassionate to parents. We need to tell them in very layman language what is the problem with the baby, because medical terminology, of course, they won't understand. And we have to be very, very, you know, they need more care than the baby itself, you know. They are psychologically disturbed. It's a big psychotrauma to have a premature baby. And at the same time, like I told you before, they are not at all sure whether the baby would survive or not. So we start from the very beginning, telling them about main fact that it is not your fault or your wife's fault that the baby has come in early. And then we start from there, that what could be the basic problems that the baby can run into, and what are the solutions that we will be providing you with our services. Then we try to just calm them down, and accordingly we go ahead.
So it's not just, I mean, obviously you're a medical professional, but you've also got a counselling role as well for parents, to give them as much information as possible.
Of course. Now everybody has got access to internet, to the media. You know, already they start reading a lot. They'll start getting into the media. They take out a lot of things. And then they come to us and ask.
So they've made their diagnosis already.
Of course. Most of the times it has.
Right. Let's just go back to the actual intensive care unit, the neonatal intensive care unit. What other facilities do you provide there at the center? See,
basically we have a unit which comprises of 12 very latest incubators, 6 ventilators. We have got a transport ventilator plus incubator, which is used to carry the babies from our hospital to different hospitals, bringing them from any other hospital, very premature babies. At the same time, when it comes to care, whether it is a premature baby or a normal full-term baby, starting from cardiac problems, respiratory problems, any neurological problems, metabolic diseases or congenital anomalies, babies born with any surgical problems, all these things are catered to in our unit. We have got a very latest unit which is at par with any other units in the, you can even say in the world, I mean, in the region, definitely.
That's what I find fascinating about this unit, though, and about the way that you've established it, because not only do you have state-of-the-art technology, you have some of the best minds in the business here in Dubai, but you've also very hands-on, because I'm fascinated by this program that you have of bringing parents who've been through the unit with their children, bringing them back into the unit a year on, to talk to parents that are going through it at the time.
Exactly. They talk about their experience, what they went through. You know, it gives a great sense of support to the other parents who are new parents, I mean, who come with their babies in our unit. When the parents who have been through, the babies have qualified through our unit, and then they talk to those guys, they obviously feel very safe in our unit.
Yeah.
Okay? And we started this unit around 1 year back. And on international standard, it says that once you start a neonatal unit, and if you are able to treat around 30 to 50 babies in the first year of your existence, then you have done an excellent job.
Okay.
And we, Touchwood, have already treated 94 babies and without any mortality for that.
In 1 year?
So in 1 year. And it is a very good achievement.
Wow.
Wow, I know.
Bringing on that, I mean, I just like that idea because it's arresting the fears of parents. As you said, you know, medical jargon, medical terminology can be quite scary to parents.
That's true.
But parents that have been through it, they can also give their own little reassurance.
Of course.
And you're providing the best support system that you
we
possibly
are trying
could.
our best, of course. As far as that is concerned, even on international standards, there's something called hospital-acquired infections. Okay? So the rate of hospital-acquired infections is in our unit is 2%. International standards, the incidence is 8.5% all over the world. In the United States alone, the rate of hospital-acquired infection in neonatal units is around 11.9%, which comes to around 12%. And ours is 2% from the last 1 year. So all our statistics have been really very good.
You're doing a really, really great job. And
Thank you so much.
If anybody wants more information on the hospital, you can go to csh.ae.
Yeah,
That's correct.
That's the Canadian Specialist Hospital, and of course you can find out all about the neonatal intensive care unit. Doc, thank you very much indeed. Thanks for being with us. Thanks for shedding a little more light. And it's great to know that we're in safe hands.
Thank you very much. So nice of you.